Hey guys, Don here. Welcome to the $1 Million Minute with Podiatry Practice Mastery, just kind of helping you get to the $1 million mark and beyond. Kind of excited. Today we're coming up on the usually around the 9th or the 10th is usually when we get our numbers. So I'll have the final numbers from 2024 for our office. I'd like to share that with you and kind of share what I'm focusing on and kind of what's worked and what hasn't worked. I want to kind of do a year-end review of might be a little bit longer of a podcast, but just kind of what we found that worked over the last year and what we want to kind of double down on. I've been really, I was playing around recently with a new app. It's a kind of an app website. It's called Submagic, Submagic, and it is a way that you can make shorter videos like YouTube Shorts, and it does a kind of a cool way of putting a transcript underneath it and things like that. So it's kind of more entertaining than just the regular little white words. So it's something that theoretically you could record videos, upload, and then have like a virtual assistant and give them access, and they can like do all the other work and the posting and things like that. So something to consider. It's called Submagic. You can kind of look that up if you want to try something new. Why is it better maybe than there's something like free like CapCut? There's a lot of other ones that are out there. This is like a paid one. I think CapCut is free, but it's harder to share it with other like virtual assistants. And they do but everything's like an add-on within CapCut. Like if you want to have cool transitions and things like that, these have some like automatic transitions, automatic zooms. If you want to see, you can go to my YouTube and just see the last two that I put up there. I'm trying to. I was listening to this guy I really like is Alex Hamosi. I don't know if you've looked at him, but he talks about sawdust, and he's like, what is the sawdust in your practice? Like, what are the things that like are just left over that you could reutilize? And so a couple of like things and so it bases on the idea of, well, they took sawdust and they put it into like boards, like they put it into not actual boards, but like plywood, not plywood, but like the stuff they put for building. They use sawdust and with glue, and they kind of make this type of board that you can sell. If you're a construction guy, you might know better than I do. But it was just a leftover thing that they didn't need and they were going to throw away. So same thing in our practice. Like what are these things that we're just kind of throwing away that we can utilize? And one of the easiest things, frankly, is to use your interaction with your patients and recording. So taking either an iPad in the office and have your staff record you, or you record little videos as patients have like success stories, or if you want to teach something, things like that works pretty well for using that sawdust. And same thing for me. Like one thing that I think is a high value but really doesn't cost me anything is when I have doctors come and visit me in the office. So it's something that gives me joy. I like meeting people and sharing what's working for me, just like I do this. But then it doesn't cost me anything, unless they're like a really not nice person and it causes stress to my staff. But for the most part, if I have someone, usually they're pretty nice, and they'll come in, spend a day with me. I can teach them, give them a lot of great value, and then it doesn't really cost me anything. Sometimes it might distract me a little bit from doing other things, but for the most part, that's a fun thing. So if you are interested in coming, I would love to have you visit the office. This 2024, I had 3 doctors come and visit me, but just kind of let me know what day. I only take one person at a time. Most people only come for one day. It gave me a lot of joy, and I've kind of done podcasts about that. Okay, let's get into the day. So first patient was a 45-year-old patient. This is the Lamisil booster. So just to remind everyone, first visit they get the nail sample. Second visit they get the first 90 days of Lamisil, and then the Lamisil booster comes at the 3-month point where I give them another 90 pills. They take 25 pills once a week, or 1 pill a week for 25 weeks, so it's 6 months about, and then another 2 months once a day. So then I don't even see them back after that because everything was looking good, so no follow-up. Once again, cutting out low-value follow-up is just as important, I think, as increasing the value, because if you cut out the low value, you can really rev up your per visit value. Other patient was a 56-year-old patient that came in. He had a very thick hallux toenail that was onycholytic and painful, so I did a hallux avulsion on him, and I took a nail sample. So I'm going to see him back to look at the nail and also just to go over the fungal treatment if he wants that treatment. Another patient came in. This is a 37-year-old female. For Cantharidin, and her wart is almost gone, and she'd been seen a number of times. She had a little cute baby with her, and she she did the Cantharidin and laser as well. So occasionally, if patients don't want Swift, we do a combo where we do laser and then Cantharidin. So the laser causes a blood blister and the Cantharidin causes a chemical blister, kind of doubling up, especially for these recalcitrant ones. Probably would have preferred to do Swift, but some patients don't want this. So she was on like visit number 6 for this. Another patient came in. This was a matrix follow-up. These are just quick follow-ups. Probably should have double booked that. If I could have done it again, I would double book the matrix follow-ups because they're so fast. Another new patient that came in, 45-year-old female. She got my plantar fasciitis number 1 visit. So that would be foam rolling, morning stretch, night splint. She had her own night splint, and I gave her some information about plantar fasciitis, and she'll try that stuff and 3-week follow-up. Another patient was a Lamisil follow-up. Once again, gave her the Lamisil booster, similar to the previous one. Another patient that was established patient, just means I haven't seen them I've seen them in the last 3 years, so I have to use an established patient visit. She decided on doing EPAT number 3, or 3 EPAT sessions, and I did the first one. And she was having pain to the proximal lateral leg to the area of the pes anserinus. So this is something I don't do a ton of, but I've had one other patient that had pain, kind of the lower lateral kind of knee area, and I consider it within the scope because it involves kind of the foot. She's having foot pain to the peroneal, so I treated that whole area with EPAT, and I find that's very effective. Kind of like tennis elbow in some sense, and I'm going to do 3 sessions of shockwave for her. Another new patient came in. This patient had a hallux avulsion on the right and an IND on the left. This was a 66-year-old female who had these issues. I'm going to see her back in 2 months. And I told her, with the one that I avulsed, I'll probably put an ONI fix on it at that time. And so one thing I've been doing for a lot of my patients is what they call it is not really positioning, but you're kind of like planting the seed on treatment. So for many patients, I'm talking about, okay, they don't mind you talking about things as long as I don't have to pay that day. This is why I think about it. So if I'm going to talk to patients, a lot of times in the first visit, I'm going to talk to them about orthotics, and I would say, they're $600. We're not going to do that today. We may consider that in the future. And I find that planting that seed, so they have the price, they're aware of it, and then in the future visit, it's a lot easier for them because they're not doing it exactly on that day. Same thing with the ONIFix. I'll say that the ONIFix is, I think we charge $125. I might do it at the next visit when I see you back. So that's the way I kind of plant the seed. So I'm not like anyone, right? You want to hear about it a few times. So I'm going to talk to them about it. Maybe, okay, we're not going to do it today. It's this much. We might do it in the future. I'm going to send them patient education information about it so they're more interested. So then when they come in, it's less of a shock for them. So I do the same thing with like a amnio injection. So I'll give them the actual consent that explains about the amnio injection. I'll talk about the price, and I'll say we'll consider this in the future. So it's a way of kind of planting that seed for them. Another patient came in, 82-year-old male for gout. So I did a Medrol dose back. He did not want a cortisone injection. Another patient came in for a cyst aspiration. This has come back the second time. We'll do it one more time, and then if it happens again, we'll most likely remove that cyst. It's in the dorsolateral foot. I don't really like removing those because I think they have like all of us do, we think it's a high recurrence rate. Another patient came in. This was a 91-year-old man, but he was a young 91, and he was concerned about his toenail fungus. And I talked to him about just live with this, but he considered we wanted treatment, so I took a nail sample, to him back in 3 weeks. Another patient came in for the Lamisil booster, as we talked about before. Another patient came in. This was a 67-year-old for orthotic follow-up. So now I'm doing more orthotics, so I have a lot more orthotic follow-ups. They were very pleased, so I'm going to see them in 2 years. I know most people say, oh, you should see them every year. I get kind of bored with those visits, and they are low. I mean, I could see doing it, but doing like a double book maybe, like double booking them, because they're not really a high-value visit for me. So that's why I'm where I'm at in practice right now, it's not the best use of my time. I think if you're starting out, you would want everyone to come back, right, as often as possible. But I think when you're working on increasing your per visit value, it's less the focus. Another patient came in. This was another 71-year-old for a nail sample. Another patient was a new patient. She had bilateral equinus, and she had plantar fasciitis on the right. And so we did the visit 1 for that, which would mean night splint bilaterally because it was bilateral, morning stretch, foam rolling, meloxicam, and she'll follow up in 3 weeks, and we'll possibly do an ultrasound. I'd get an x-ray on that patient as well. Another patient came in for EPAT, so I did soft wave and radial shock wave for her Achilles tendon because they're letting us use the soft wave to kind of try billing it out. We have not got paid yet. I've heard some people are getting paid by Medicare for using some of the focused shock wave, either focused from Chirometrics or the soft wave. So something to consider. If you have any questions about that, just send me an email. There was another patient. I gave a prescription for Lamisil. Kind of a new patient, had previous LFTs recently, was previously treated. This is something I see quite a bit. This was another doctor in our practice. He gave him 90 pills of Lamisil. His tinea pedis got better, but then everything came back. That's why I do the booster. Maybe not everyone's going to have that, but his kind of really came back in 3 years, and so I'm going to do the whole regimen again, but kind of doing this booster and doing the shoe treatment as well for him. Another patient that came in, this is a 60-year-old, really active guy. He had Achilles pain. We did 3 shockwave sessions, and then I tend to tell my patients after that they want to avoid having their heel below the weight-bearing surface, like those really deep heel dips or the slant boards. I have them avoid that. He was doing that because he learned it from someone, or maybe he watched a video, and I just said, please avoid that, so this doesn't keep coming back. Another patient was a 15-year-old that came in for orthotic follow-up. She had bunions and was with her dad. And she was a really kind of an active gymnast and wanted to know if she should have her bunions fixed. She's young, she's skeletally mature, but they don't hurt her. So I didn't recommend doing the bunion surgery. She might need it in the future, but if she wants to be a competitive gymnast, maybe doing it with the bunions is better than without the bunions. My main recommendation for these young females is Anya's Reviews. It's a review website that has cute shoes that are anatomic. Another patient came in. This was a diabetic for a CDFE, and I did a nail sample. And he's a kind of a well-controlled diabetic, so I'm going to see him in 1 year. And for him, I usually see nail samples back, but I'm not too convinced that this nail sample is going to be positive. So what I told him is I'm going to call him, and if it's a positive one, I'm going to have him come in. But if it's not positive, I'm not going to make a follow-up. And I'm tending to do that more because more and more I have patients come back after a nail sample, and if they're negative, it's just kind of a waste of a visit. It's a very low-level visit. It's not really kind of worth anyone's time. Once again, trying to increase the per visit value. That's why I'm doing that. And then the last patient today was an orthotic follow-up. She was doing fine. We had an adjustment done previously. Now she's feeling fine. And she had some painful, like her hammer toes were clenching down, so I gave her a little crest pad. What I tend to do with crest pads is I say your first one's for free. Most pads I just kind of give away. And then the following ones that they can buy them. Okay. So that is kind of the day. I had a nice call during the lunch hour with a guy named Sean, and we are kind of working on Facebook ads for my Swift. And we're getting some leads to it. If you want to see the website, where it's pushing to, it's www.fixmywart.com. It's a landing page. I'm kind of proud of it. It has a nice intro video you can see with the nice words underneath it. It has some good copy or written stuff that's sales copy, and then it has a lot of testimonial videos that I put on there with a request. You can certainly request the books. You can get on my email list, and you'll see the emails. So feel free to, if that's helpful for you, you can use that. But that's what I'm trying. That's what I'm sending traffic to. So you can kind of see how I'm doing that. Just go to fixmywart.com. This was a domain that I found. I tried to find Fix My Heel, but that didn't exist. That was sold. So I'm starting with the wart one. I'd like to maybe do another one for the heel pain, and then just kind of drive traffic to that. Let me know what your thoughts are. Shoot me an email, don@podiatrypracticemastery.com. Love to hear if you want to come visit me. It's always fun. There's some sawdust. I have some extra time because now I have Morali doing my notes, so I can just kind of hang out and we can chat and we can share ideas. Okay, because what I like about it as well, because I always learn things from the other doctors that come, and then I can create more content and share more things that I'm learning. Okay, hope you guys enjoyed this. Have a good one.